Good afternoon. My name is Dr. Angela Cooper Brathwaite. I'm a past president of RNAO and co-chair of the Black Nurses Task Force. It is my pleasure and privilege to bring you greetings during Black History Month. We may ask ourselves why we celebrate Black History Month. It is a time to remember and reflect the Black people's history in North America. We celebrate the heroes, remember the forgotten stories, and Black people's contributions to Canada. We also remember the brutal and devastating legacy of slavery and the persistence of racism in Canada. Today, I am highlighting my experiences, challenges, and significance with being an RNAO member. The RNAO has provided numerous opportunities to serve nurses, patients, and the healthcare system in Ontario. For example, it had provided me opportunity for leadership at the executive level as a past president of RNAO. This prestigious organization and leader in many areas of healthcare, including best practice guidelines. I served RNAO as a board member from 1996 to 1998, 2014 to 2017, and then from 2017 to 2020, part of it being immediate past president as well from 220 to 221. Policy and political ENO, I was for the chapter and interest groups, and I also had the opportunity of being a founding member of the International Nurses Interest Group and the Black Nurses Lead and Change Interest Group. I had the opportunity to submit numerous resolutions to improve nursing care, standards of practice, and policies at the provincial and federal level. In 2006, I was influential in having the provincial government amend the Ontario Building Code to include stair design, handrails, and guards in Ontario. RNAO and OPHA supported this resolution to make it happen. Similarly, in 2009, I was influential in having the provincial government amend the Highway Traffic Act, distracted driving, and passenger safety through letter writing campaigns, submissions of reports to the provincial government standing committee at the Legislative Assembly. For several years, I've advocated for the federal government to amend the building code in Canada. It was finally amended in 2015. Today, we have a chief nurse at the federal level. This position was filled because RNAO, including our CEO, RNAO members, and myself, advocated for this position to be reinstated. RNAO has advocated against anti-Black racism and other forms of oppression. For example, the Black Leading Task Force report was launched in 2022. So many different medias covered our story and how nurses was experiencing racism in Ontario, Canada. I have been a member of many different committees at RNAO to support policy change. One of the policies I suggested when I was sitting on the board as president is for RNAO to have a policy that any future president must serve on the board of directors before running for president of this organization. My challenges at RNAO are minuscule. RNAO has provided numerous opportunities to enhance my knowledge, skills, and abilities and career advancement. RNAO facilitated my career advancement through giving me numerous leadership awards, and our CEO nominated me for the Order of Ontario and Order of Canada, which I received in 2022. I've learned different techniques to advocate for nurses, nursing, and healthcare, such as using social media, action alerts, speaking directly to politicians at different levels, with evidence-based practice and evidence-based knowledge supported by the RNAO. I've had opportunities to increase my knowledge and skills by attending conferences, webinars, and other educational events, and they are free educational events, as well as attending the ICN. My first ICN was in 1993, and I presented a study on physical abuse against nurses in Ontario. The results resulted in the ICN acknowledging that physical abuse, verbal or sexual abuse against nurses should not happen. This resulted in Canada, and I know specifically Ontario, having a code white. So when a nurse is being physically abused, we call a code white in that healthcare setting, and people come to that site to help us. I close with part of RNAO's statement. RNAO stands together with those who continue to suffer the scourge of anti-Black racism and discrimination. RNAO unequivocally condemns racism, oppression, and discrimination in all forms. For example, in 2022, RNAO released of the Black Nurses Task Force document, which talks about anti-Black racism and systemic racism in nursing. Because of that media interview and many publications from that report, many people have asked me to speak at their conferences on racism in nursing. It is with sincere thanks I acknowledge the RNAO for recognizing nurses during Black History Month. Thank you.